I'll be briefer then. I'd like to move that the bill is now read a second time, and I'm really pleased to introduce the Health Amendment Bill 2023 to the Dáil this afternoon. This bill means that adults will, for the first time, have free access to inpatient care in public hospitals. At the moment, people are charged €80 a night for their stay in public hospitals, up to a maximum of €800 a year. It's a very large bill that people face, €800 a year, and many people are having to face that bill when they may be very sick, they may be unable to work or only be able to work part-time, or they may be finding it harder to make ends meet. Last year we abolished this charge for children aged under 16, and this bill does the same now for everyone else. It's an important measure in its own right. It's also an important measure as a very clear symbol of our path towards universal health care, a public health service that is free or affordable for everyone in the country. Colleagues will be aware that over the last 3 years we have been radically cutting the costs of health care for patients and for their families. In 2021 we reduced prescription charges, we increased medical card access for those aged 70 and over, and we extended to 2 years medical cards for patients who have a terminal illness diagnosis of 2 years. Last year we abolished inpatient hospital charges for children. We introduced free contraception for women aged 17 to 25 and reduced the maximum monthly amount families pay for medicines. We reduced that first in 2020 and then last year, and it's been reduced from €114 to €80. This year, already this year, we've increased the age of free contraception up from 25 to 26 so that no woman aged out of the scheme. This bill we have here before us abolishes inpatient charges for adults, and in the coming months we're providing GP cards to around 500,000 more men, women and children. This will mean that for the first time ever, more than half the population will have access to fully state-funded GP care. Later this year, we're increasing the free contraception scheme age to those aged between 16 and 30, and we're introducing state-funded IVF for the first time. So combined, I think all of these measures are welcome, but combined, these cuts in costs for patients amount to a radical shift in our country towards universal health care. They're already making an important difference for many patients and for their families who are using our health services, our public health services around the country. They're being introduced in tandem with new services for patients like IVF and the many other women's healthcare measures, including, for example, specialist services in endometriosis, perinatal mental health and menopause, and in tandem with better access to medicines. I was delighted to be able to share the news last night that Kaftrio will now be funded for the 35 children who were excluded by the company involved and were excluded last year. At the same time as rolling out the new services and as medicines, we saw last year an important fall in the number of people on waiting lists, particularly for those waiting longer than the Sláinte Care agreed times of 10 and 12 weeks. While I fully acknowledge that there is a long way for us to go on the waiting lists, this is the first fall since 2015, and it is an important step. I'm absolutely determined that this year will be the second year in a row where the number of people on waiting lists falls again. And again, we're focusing in the first instance on those long waiters and those waiting longer than the agreed Sláinte Care targets. This three-pronged approach, reducing costs for patients, providing new services for patients and speeding up access for patients, is how we are pursuing universal health care. The simple idea, core to the values of our republic, that people can get access to great quality, affordable care when they need it. Specifically to this bill, I'd like to acknowledge the work done by officials in my department, and importantly by several patient advocacy groups, including the Irish Cancer Society, who've been advocating for this measure, for this charge to be abolished. They've been advocating for many years. I'll now provide a brief explanation of the sections of the bill. It's a very short bill. Section 1 repeals Section 53C of the Health Act 1970. Section 53C provides that charges shall be made for acute inpatient services provided by or on behalf of the Health Service Executive. Section 1 also revokes the Health Acute Inpatient Charges Regulations 2021. SI number 213 of 2021. These regulations currently provide the legislative basis for the persons liable for the acute public inpatient charge, and that the maximum number of days this daily charge may be imposed over a period of 12 consecutive months shall be 10 days. Section 2 contains standard provisions setting out the short title, citation, and provides that the bill should be subject to a commencement order. The key effect of these amendments is to remove the acute public inpatient charge of €80 a day for people accessing care as a public patient in all public hospitals. While we have the opportunity, I'd like to give some details on other eligibility measures being introduced this year. Now, first of all, the GP visit card. As provided for in the budget, from April, eligibility for GP visit cards will be extended to people earning up to the median household income. This measure will remove the cost of accessing GPs from those for whom cost is most likely to prevent access, helping reduce the cost of living for young adults and young families in particular. Over 400,000 individuals, we believe between 400 and 500,000, who would otherwise have attended their GP on a private basis, will now be able to attend their GP essentially on a public basis, funded by the state. And we're also working with the IMO on expanding GP care without charges to all 6- and 7-year-olds this year as well. Coinciding with the medium income expansion, a significant funding package is being prepared to support GPs, to hire a lot more GP practice nurses and other supports that the GPs are going to need to be able to manage the additional demand that this measure will inevitably bring into place. We're expanding the free contraception scheme, as colleagues will be aware. We launched this last September. We've had very positive feedback on it. It was an historic initiative providing free access for the first time to prescription contraception and directly supporting women and their partners in sexual and reproductive health. The scheme will be expanded further to women aged 30 and under in September. 32 million has been allocated, and as I promised in the House last year, this funding includes expansion of the scheme to 16-year-olds, subject to consultation, legal advice and legislative amendments which are required for this. We're also looking at assisted human reproduction, as colleagues will be aware. We have a commitment to introduce publicly funded care for fertility treatment. Phase 1 has involved the establishment of 5 regional fertility hubs across the country. These hubs are operational, and it's anticipated 5 are operational. The 6th will be operational later this year. And essentially these hubs are for the management of a very large portion of patients presenting with fertility issues at this level of intervention without the need to undergo invasive advanced assisted human reproduction treatments. Phase 2, however, will see the introduction of tertiary fertility services, including IVF. The plan ultimately is all of these services will be provided by the public health service, and we're expanding those services, but we don't want to wait the several years that it will take to ramp up those services to provide it for all women and all couples who want to avail of the service. So in the shorter term, we will be funding, subsidising private care and then essentially ramping up the public care so that ultimately it is fully publicly delivered. We spoke about Kaftrio, and it's very important, obviously, that we create better access to medicines. Since the start of the government, we've allocated about €100 million for new medicines. The full year costing of that is significantly higher. That has meant 112 new medicines or new uses for existing medicines, and critically, 34 of those are for rare diseases, the so-called orphan drugs, which cost usually significantly more than the mainstream drugs. We're also committed to delivering faster access to new medicines for patients. I want to see improvements in the transparency of the process, and I've asked the HSE to bring forward proposals to that effect. Colleagues will be aware also we've allocated €15 million this year for new state-funded oral health services for children from birth up to the age of 7, which I think in the coming years as a public health initiative is going to make a big difference. So colleagues, can I say the programme for government is committed to universal healthcare. It's committed to Sláinte Care as a key enabler of that. One of the 3 pillars of universal healthcare, obviously, is free or affordable care. A lot of progress has been made, more progress will be made, and this bill before us tonight does two very important things. It removes a charge of up to €800 a year from patients and their families, and critically, for the first time now, public hospitals will be free for all patients in terms of inpatient care. I think it's a very important step on our way to fully free or affordable public health care provision in our country. Gur Mágat.